Hello again. Now I'm really happy to be introducing our research extraordinaire, Nathan Lachowsky. He's an assistant professor in the School of Public Health and Social Policy at the University of Victoria. He has conducted HIV and sexual health research across Canada and New Zealand with gay, bi, and queer cis and trans men who have sex with men, using interdisciplinary and community-based approaches. He completed a PhD in epidemiology from the University of Guelph, during which he completed junior and senior fellowship with the CIHR University, Without Walls program, and held a Vanier Canada Graduate Scholarship. He completed a CanFAR CTN postdoctoral fellowship with the British Columbia Centre for Excellence in HIV/AIDS, working with the Momentum Health Study. Welcome, Nathan.
Hi, good morning, everyone. For the folks that are on the floor, if you're comfortable there, that's great, but there are some seats near the front if you want to come up.
We also have overflow in 1700. And in room 1700 right next door, we're also live streaming the plenaries as well, so there's also additional room in those theaters.
All right, good morning, everyone. I just want to add my acknowledgement to the territories. Thank you very much for that presentation, for the words, and for sharing those teachings with us. For me, this is, I also see myself very much on a journey. And in my new role as research director at CBRC, which still always feels, I'm always surprised that this is happening. I'm thinking a lot about the ways in which Sex Now can move in the future. And I really want to thank especially Harlan Pruden, who I got to spend a lot of time with this summer, who really guided me in terms of some of my thinking around some of what we're doing. And for me, I think part of that work is about showing up. And I think I take to the comments that were made earlier around what can we offer and what are we really offering? And showing up into spaces and community that we haven't been before. When I think about Sex Now, I mean, one of the first places that we actually started recruitment this summer was at a Two-Spirit powwow in Winnipeg. And that was a new space for us to be in. It wasn't a part of the official Pride space where we've been before and where we spent a lot of time this summer. But it was a community gathering that we put a lot of effort into being at. And I think I'm not very good with linear presentation, so I'm going to end up jumping back to slides. But I think for me, what was important about that was being there in person, being able to shake people's hands, to introduce, to say each other's names. And that's a really different process than a lot of research is taking nowadays. And I think there's such a push for online surveys, and there's absolutely value in that in terms of creating greater accessibility for some folks. But I think there was such a learning for me this summer in terms of being in person and being able to share those experiences together. So I'm here today to give a little update on where we are with Sex Now. Just by a show of hands, how many people have heard of Sex Now before? Great, okay, good. And that is, I think, because we're going to start with just a really brief history of what Sex Now has been and where it's come from, and really paying homage to the many, many folks before me that have come, that I get to be on their shoulders on. And then I'll talk a little bit about what we did this summer in terms of Sex Now 2018. I'll talk just very briefly about ending the ban and this aspect around blood donation, and then talk to you a little bit about what our next steps are. So the comments were made a little bit earlier in terms of the founding of CBRC, but I really want to add my acknowledgement and thank you to Rick Marchand and Terry Trussler for the work they did to really create all of this. When I think about Jody feeling like a father, when I think about the two of you in terms of this is really because of your work. So thank you so much. Thank you also for believing in me as a younger investigator in terms of being able to take on research directorship for the CBRC. It's a real honor, and I've really enjoyed it so far. And I think a lot of this work in terms of Sex Now was really rooting community-based research at a time when there wasn't the same space or dialogue. And now we see many different manifestations of this in the current response, whether that be within the HIV sectors or outside of it. CBR isn't something that, it's something that when I go across students and teach them now, many of them have heard about it, many of them want to come to school and to learn specifically about community-based research processes, and that's shifted a lot because of the work and the leadership that Rick and Terry and others at CBRC had. And that really fed into where Sex Now began, which was many, many years ago in various community health surveys. And what was nice about this offering in 2018 was the ability to go back to our roots of being in person. So you'll see here in some of those very early iterations of Sex Now was the fact that we were in community at Pride festivals across BC. And so what we've done in 2018 is go back to that. So like all things as technology developed, during the online surveys launched, and that was a way for us to reach folks in new ways that weren't necessarily able to participate or could access Prides. And that provided a lot of opportunity. And the nice thing about 2018 is that we get to do both of those. And so we're able to be in person and collect those surveys, but also go online. And I mean, I just wanted to include some photos from some of the early survey days because we'll show you some photos from 2018. And I just largely want to say that we have not changed a lot of how we do this. And I think that's just the timelessness of the approach, as well as the amazing design and all of that went into it. So just keep in mind these photos are from 15 years ago. And I'll show you the photos, or some photos at least from the summer. So that's, in terms of 2018, we had an amazing partnership with folks across the country, and I was putting this together, and I was like, I'm inevitably going to forget someone, and I did. I forgot Sunshine House in Winnipeg, who is the organization that helped with the Two-Spirit Gathering. So thank you to Sunshine House. Thank you to all of the other partners that are listed up here. And these are really some of the folks that provided letters in terms of some of the grants that we were able to secure for supporting the endeavor. As well as folks that also provided on-the-ground labor and work to make this happen. So there's other folks that also volunteered from other agencies, so by no means is this an exhaustive list, but hopefully it gives you a little bit of the flavor. And what I really like from that in terms of CBRC is that trying to do this work nationally really requires strong local partnerships. Folks who know their communities well, who know the different spaces and the different places that we should be in. And so this really wouldn't have happened without everyone else. So although it is a CBRC initiative in many ways, I like to see this as a very collective family effort. I also want to recognize the Public Health Agency of Canada and John Kim, Dana Paquette, who's here, who will be presenting tomorrow on some work. The Public Health Agency of Canada has been a great partnership in terms of Sex Now for the summer. All of the supplies of materials in order to collect the dry blood spots that we did along with the surveys, as well as all the testing for that were provided in kind. And that was, we wouldn't be able to do that without that support. And so we were really excited to go back in the field. It had been a number of years. We had been online for a while. And it was like, okay, we have this chance to go and be at all of these different places across the country. And largely what we experienced was really not great weather. We started in Winnipeg. It was raining on the first day. It was cold. Trying to draw blood from anyone on any day is a challenging task. I give my... but I mean, when we were trying to do it in the cold and the wet, when your hands are cold, and it was, I think that was part for me around the being in person, is we literally would hold people's hands and rub their hands, and I think that was a really human way to build those connections. So a shout out to the Weather Girls for their infamous It's Raining Men. It was going to be either I would do a little song to that or Don't Rain on My Parade, but I'll just save you all and not sing anything. But it was funny, I think, in some ways, during the weather kind of followed, whether it was in Winnipeg or Edmonton or Toronto or Halifax. I mean, there was not always the idyllic Pride weather. But nonetheless, I think folks still came out, and I think that was amazing. But I want to just thank all of the volunteers and all of the staff who took their time to be cold and wet and spent hours and hours in terms of doing collection. We had hundreds of volunteers that we trained across the country. And this was in terms of recruitment for participants at the Pride festivals or other events we were at, as well as in terms of dry blood spot collection. It was a lot of learning for us, and some people were really good in terms of drawing blood. Some people were too good at drawing blood to the point where we had a few people faint sometimes. But on the whole part, everyone had a good time, and juice boxes tended to fix everything. But it was amazing to me. I think one of the things around this as well is how willing our communities are in terms of coming out and spending time during Pride festivals, during what is meant to be a time for celebration, to volunteer their effort during an end of themselves to be able to contribute to this research. So again, I mean, I've talked with the community partners, but really we would not have been able to do this without the volunteers. It was a lot of person power. So in terms of the actual collection, I've just included a few different photos here. We took our booth and our t-shirts and our surveys and our blood spot cards across the country. We visited 15 different communities, and we collected over 3,600 surveys. So I'm really proud of that. These surveys are not just about one particular issue. And when I hear about the things that are being talked about, I think about the questions we have around mental health and loneliness, about connections to community, about substance use, doing a whole different range of questions that are valuable to all of the work that folks are doing. And so we're in a process now of entering those surveys. The one thing about doing paper surveys, which is relatively quick and very low tech, is that we then have to enter them afterwards. So many thanks to the many people that are helping us with data entry. And by next year, we'll definitely have our results in terms of sharing lots of the different findings. And I think the other thing around the survey I just want to mention in terms of thinking about truth and reconciliation and work around that is we spent a lot of time listening and hearing from different folks who had advice around how to make the survey better. And that resulted in a few questions that we asked specifically of our Indigenous participants. As well as also thinking about the ways in which we order the questionnaire and the options that we create. So this wasn't just about asking questions that were specific to Indigenous people and Indigenous communities. This was about thinking about what are the different forms of mental health and services and support, and how can we think about making sure that our questions capture that full range of realities and options for people. And so I'm really proud of those changes, and again, I want to thank Harlan and others who helped contribute into that. As well, we had a lot of conversations with transmasculine folks in terms of their feedback on the survey. This has been one of the struggles, I think, of our sector in terms of bringing those folks in and making sure people are validated and heard and feel like their lived truths are reflected in the surveys. And so we did a lot of work to try and make sure the ways we worded questions, the options that we had for people to respond to, did work for a variety of folks with different bodies. And I was really glad in Winnipeg I spent a lot of time doing collection in terms of blood spot, and when you're like waiting for someone's blood to drip out of their finger, you've got things to talk about. And so I talked with a bunch of the trans guys that did the survey there, and they enjoyed some of the options that we had. Some of them were a little bit more playful than others. There's one particular question on the survey around testicular cancer, which Rob was really keen on, and we added an option that says, I don't have balls. And that, it seemed to work really well. So I think this is something that I think is really doable. And so when I hear people talk about the complexity or the difficulty in doing that, I get it. But at the same time, I think during it's 2018 and we just need to do better. And so I'm really proud of the work we did around that. And then in terms of the dry blood spots, this was also new. So this was something that we had never done before in terms of CBRC. We had lots of experience with ManCount, one of the sites of the MTRAC studies here in Vancouver. And so we took a lot of the lessons that we learned from that and were able to implement that in this national effort in terms of Sex Now. And over 85% of people agreed to give blood. I mean, that to me was like amazing. We had expected maybe 2/3 if it was good in terms of that, but 87% of people agreed to give blood. And that to me, when I think about like everyone's Pride experience, is like they was supposed to be a 10-minute survey that did not be. It was not 10 minutes. And then they stayed to like have their finger pricked and give a few drops of blood. And that is, I think, just again, an amazing reflection on our community. This required a lot of logistical work, and so there were tons of protocols and things that we had to develop as a result of that, and we have learned a lot that we're happy to share with folks. I think one of the things that I'm really excited about in terms of blood spots is a lot of the previous surveys that had used this kind of survey and blood spot technology had done it completely anonymously. And the goal of that was to make sure that people could participate without having to share their name and feel like it was an easier way to be a part of the survey. And some of the feedback we got as we did consultations across the country was that if we're collecting blood, people have a right to their results. And they deserve to be able to know what those results are if they want to. And so we spent a lot of time talking with Ministry of Health, Public Health Agency, community groups, in terms of how we could do this in a way that wasn't violating regulations or laws. And thankfully, we were able to have people to participate in the survey without having to share their name. But if they wanted to get the results from their dry blood spot, then they could opt into that that if they'd like to, and they could provide a phone number or an email. And as we're just getting the lab results back now and linking those in with the surveys, we'll have a process in terms of going back to folks and letting them know whether their results matched up with what they said on the surveys or whether they were different. And we're not just letting folks know what they are, we're also doing work with local testing services. So in each of those sites, we're pre-contacting services to let them know that we did this survey and we might have a few guys that we want to refer to your services to check them out to make sure they're appropriate services. And then to hopefully help expedite people so that if they want to go in for confirmatory testing and access care, that they can do that. So I think that's a really exciting innovation as well, and one of the ways in which I think we're trying to think about reducing barriers to access and information around people's HIV and Hep C status. And just I think in terms of a little bit of background, I mentioned PHAC and their collaborations in terms of the lab. I figured I'd include one selfie photo, so this is Rob and I at the Public Health Agency lab. Which was great to get to go because that lab is a group of largely technicians that are doing testing for a variety of different populations and communities on a bunch of different infectious diseases. And so we got to give a little bit of a talk about Sex Now and CBRC and gay men's health and the work that we're doing in terms of thinking about what is the reason for doing this research and what's the value of doing it. And I think it was a really nice opportunity to get to meet the people that would be handling all of these specimens that would be doing that testing and for them to understand the people and the stories and the history that go into that. And again, I think for me, this has really been about that relationship building process in terms of understanding who we are and how we're connected to each other. We also had quite a bit of media interest, and I will give a big shout out to the folks at Max who did an amazing job in terms of drumming up media. And so we had coverage in terms of news stories, during video, print, and I think this really spoke to the political aspect of this survey. This is political. To participate in research in this particular research study is political. And there are issues that we were interested in on this survey, in particular this issue around the ban against men who have sex with men from donating blood. And that was something that really got picked up in the media. And so we're looking forward to being able to share the results that we collected in terms of intersecting in that conversation around the policy change that is necessary in terms of removing structural stigma and discrimination. I included Rob, who I would say was our, so Rob Higgins, our Sex Now research manager, who, yes? Sat down with Dana Pickett, the chief scientist, and gave a hard-hitting interview. So if you haven't watched that interview and are interested in this issue, I would definitely say to watch it. And I think it's been really interesting trying to work with CBS on this issue. There's a lot of folks in that organization that understand what we're saying. And what we're trying to do now is to make sure that they get the information they need and the evidence they need to do their jobs in terms of appealing to Health Canada to change the policy. It was amazing to see folks in community that were really also passionate about this issue, and this was a big part of why they wanted to come out and participate. And so I think that was awesome. In terms of next steps, I'm pleased to share that as of Friday, we found out that we were successful in another large grant from Canadian Blood Services MSM Research Fund. This new study is going to take us in a bit of a different direction than where we've been with Sex Now. So this new study that just got funded on Friday is going to look at a general population survey. So for a long time, we've known that the way in which we're treated by others impacts our health, and that dates across the entire life course. And so what we'd like to do is take this general population survey and talk to them about this issue, their perceptions, their attitudes towards the blood ban issue, but also in terms of the broader issues that feed into that around homophobia, biphobia, transphobia, and so on. We're also going to start working with blood recipient groups, so folks that rely on blood products, and talk with them about how they feel in terms of this issue, what would work for them. Already in those initial discussions, there's a lot of solidarity in terms of understanding. I mean, there's folks in our community, there may be folks in this room that rely on blood products, either on an ongoing basis or at least at a temporary basis. And I think what we're trying to do with all of this is realize that we have those connections across these groups, and to triangulate all of that research to be able to say to CBS, to HEMA Quebec, to Health Canada, that we have a solution to this that is bought in by all of the key stakeholders, during our queer communities, during people who receive blood, and the general Canadian population. And so my attitude, although maybe somewhat naive, is that if we do that and if we do it well, we will see the change that we want to see. So fingers crossed on that, and you can absolutely hold me to that over the next few years. In terms of next steps, as I said, we're doing our data entry and linkage and sharing those results back with the individuals who asked for that information. We'll also have some exciting things happening with investigators, and I won't say too much about that, but other that there's been a lot of interest in investigators across the country, and I think we're very interested in how we can try and build local capacity in different places. The program's been running successfully here for a number of years, and they've been a key part of the SexNow surveys in the past, and so we're excited to be able to share that data with the investigators programs here in Vancouver, in Toronto, and elsewhere to help them in terms of interpreting the data and using it at a local level for the different things that are going on and relevant to their communities. Also, this is an older photo from SexNow when they went online. What I love about this photo and the story behind it is that people thought they were just like, you should have sex online. Which you should if you want. And similarly to the past online rounds, we'll be doing an online version to capture folks who want to participate in the survey and provide their feedback and input that weren't able or don't want to participate in the Pride festivals or events that we were at. And so we're working on that and the translation, and we're pretty close. We hope to launch that before the end of the month. And so looking forward to that as well. So we've got lots of stuff going on. I'm really excited about all of it. I really can't help but be like, I'm not the right person to be standing up here talking to you all about this. I barely feel like most of this is even my work. It really is done by a huge team of people who I want to thank. So first and foremost, the folks from our community who came out and participated, who volunteered, and who spent their time during Pride, and who will take the time to do it online. This really doesn't mean anything and doesn't do anything unless those folks participate, and I think that's really important. The next were all the community partners, and I showed you that slide earlier in terms of that, and the National Alliance has been an amazing partner in terms of trying to strengthen our relationship across Canada in this response. All the different staff at CBRC, at the various agencies that we worked with, as well as the volunteers that came through that. In particular, I want to recognize Rob Higgins. This is Rob. If you don't know Rob yet or haven't met him, he was the one who did this whirlwind tour of all of the different Pride festivals across Canada, every little gay boy's dream, or nightmare. I remember like sitting down with lunch for Rob a little bit later in the summer, and he was like, I can see the end now. But had an amazing time, and I think had amazing hospitality across the country as well. So a huge thank you to Rob. Rob, are you in the room? Sorry if I can't see you. Hi, he's at the back. Thank you, Rob. Many flights and hours and long days in various weather conditions in terms of pulling this off, and it really wouldn't have been possible without you, Rob. So thank you for stepping up to the challenge, and I'm always hopeful that you had a great experience with it. And I know we've talked about it as a once-in-a-lifetime like summer, but we'll see. I do think one of the things that I really realized in going out to the various Pride festivals, and I was able to be at a few of the sites, but not all of them, is that I would really like to see us continue going back year after year, or at least periodically, to share back what we learned. And I think this aspect of like being able to continue those relationships and being in person with folks, I think is really valuable. So it's definitely something that I'm interested and committed to in terms of trying to think about how can we resource that to get folks back into those communities so that we're not just coming and taking, but that it's a continual relationship. So we'll work on that. And part of all of this is really possible because of the funding that we had. So doing a large grant from the Canadian Blood Services MSM Research Fund, who supported this work. The views of this work aren't necessarily the views of CBS and the various levels of government, but absolutely those dollars that flow through are part of what made this possible, as well as the Public Health Agency of Canada and MyTax, who also helped support Aidan Nablona as one of our research students. So thank you to everyone, and thank you very much for listening. And I don't really know how we're doing on timing, so we probably don't have time for questions or comments. But I'm around, so please feel free to ask me, or you now know what Rob looks like, so you could also ask Rob. So thank you, everyone.
Thank you, Nate. So I just want to let everyone know that at the same table where we picked up our programs, the Health Initiative for Men is also providing harm reduction tools for us. So if you want to pick up condoms or crystal meth pipes, they're available for you as well. And also, I need to let everyone know that we got a note from security about people sitting on the aisles and how that's no longer allowed because of fire safety and things like that. So please find a seat, cozy up. We have the overflow room in 1700 if you want more space for yourself. But speaking of lack of space and lack of seats, we're hoping maybe with some more corporate funding, we can secure a place with more seats next time around.